Thank you very much. I have extended that by about 5 minutes, but I'm hoping that you're all feeling a lot more refreshed than before the start of the meeting. I just want to publicly thank Steve, who actually sanded down the gavel for me so that I can actually touch it because it's now nice and clean. And not very, so thanks to Steve, because I appreciate that. That's very good. So I'm not afraid to use it tonight. Okay, moving on. We now move on to item A after the adjournment, which is for me to invite the leader to move his recommendation as set out on D42, 43, 44 and 45 without discussion.
Thank you, Chair. I move recommendations as set out at D42, 43, 44 and 45 inclusive, and look for a seconder.
Councillor Hutchinson as a seconder, thank you. Councillor Garrett, you wish to propose your amendment?
I so move my amendment, yes.
Thank you. That's again without discussion. And do we have a seconder to Councillor Garrett's? Councillor Redgebarry, thank you. We now have a named vote. All those in favour of the amendment? On the yellow paper.
Councillor Andre. Downer. Sorry. Councillor Downer. Councillor Fuller. Councillor Howe. Councillor Medland. Councillor Smart. Councillor Stevens. Councillor James Evans. Councillor Love. Councillor Baker-Smith. Councillor Lilly, Councillor Brodie, Councillor Barry and Councillor Garrett. Thank you.
And those against, please.
Councillor Abraham, Councillor Axford, Councillor Bertie, Councillor Beston, Councillor Brading, Councillor Chapman, Councillor Churchman, Councillor Hastings, Councillor Hobart, Councillor Hutchinson, Councillor Kilpatrick, Councillor Mosdell, Councillor Merwill, Councillor Outlaw, Councillor Peace, Councillor Perks, Councillor Price, Councillor Quirk, Councillor Tyndall, Councillor Ward, Councillor Whittle, Councillor Whitehouse, Councillor Cameron and Councillor Stewart.
Are there any abstentions, please?
Councillor Nicholson.
That amendment falls. The numbers are 14 for, 24 against and 1 abstention. Thank you. Councillor Lilly, could you propose your amendment, please, as set out on the green paper?
I propose the amendment.
And a seconder? Councillor Brodie, thank you. It's going faster than I can write. Chairman, to ask for a name vote, please. So, all those in favour of the amendment, please.
Councillor Andre, Councillor Downer, Councillor Fuller, Councillor Howe, Councillor Medland, Councillor Smart, Councillor Stevens, Councillor James Evans, Councillor Love, Councillor Baker-Smith, Councillor Lilly, Councillor Brodie, Councillor Barry and Councillor Garrett.
Thank you. Those against, please.
Councillor Abraham, Councillor Axford, Councillor Beston, Councillor Brading, Councillor Chapman, Councillor Churchman, Councillor Hastings, Councillor Hobart, Councillor Hutchinson, Councillor Kilpatrick, Councillor Mosdell, Councillor Merwill, Councillor Outlaw, Councillor Peace, Councillor Perks, Councillor Price, Councillor Quirk, Councillor Tyndall, Councillor Ward, Councillor Whittle, Councillor Whitehouse, Councillor Cameron and Councillor Stewart.
And those against, please. Oh, sorry, abstention, sorry.
Councillor Bertie, Councillor Nicholson.
So that amendment falls with 14 for, 23 against and 2 abstentions. Councillor Brodie, could I please ask you to propose your amendment?
I formally propose it, Chair. Thank you.
Thank you. And your seconder, Councillor Lilly. Thank you. So we have a named vote again. This is on the lilac paper. All those in favour, please show.
Councillor Axford, Councillor Price, Councillor Andre, Councillor Downer, Councillor Fuller, Councillor Howell, Councillor Medland, Councillor Smart, Councillor Stevens, Councillor Jones-Evans, Councillor Love, Councillor Baker-Smith, Councillor Lilly, Councillor Brodie, Councillor Barry and Councillor Garrett.
Thank you. And those against, please.
Councillor Abraham, Councillor Bertie, Councillor Beston, Councillor Brading, Councillor Chapman, Councillor Churchman, Councillor Hastings, Councillor Hobart, Councillor Hutchinson, Councillor Kilpatrick, Councillor Merwill, Councillor Outlaw, Councillor Peace, Councillor Perks, Councillor Quirk, Councillor Tyndall, Councillor Ward, Councillor Whittle, Councillor Whitehouse, Councillor Cameron and Councillor Stewart.
And abstentions, please.
Councillor Mosdell, Councillor Nicholson.
That amendment falls. 4, 16 against, 21 abstentions 2. Thank you. We now move to item E, which is the vote on the substantive motion, which is the original proposal as moved by the leader. Could I have a name vote? All those in favour, please.
Councillor Abraham, Councillor Axford, Councillor Bertie, Councillor Beston, Councillor Brading, Councillor Chapman, Councillor Churchman, Councillor Hastings, Councillor Hobart, Councillor Hutchinson, Councillor Kilpatrick, Councillor Mosdell, Councillor Merwill, Councillor Nicholson, Councillor Outlaw, Councillor Peace, Councillor Perks, Councillor Price, Councillor Quirk, Councillor Tyndall, Councillor Ward, Councillor Whittle, Councillor Whitehouse, Councillor Cameron and Councillor Stewart.
And those against, please.
Councillor Andre, Councillor Downer, Councillor Fuller, Councillor Howell, Councillor Medland, Councillor Smart, Councillor Stevens, Councillor Jones-Evans, Councillor Love, Councillor Baker-Smith, Councillor Lilly, Councillor Brodie, Councillor Barry and Councillor Garrett.
Are there any abstentions, please?
None.
That motion is carried. 20, is that 23 or 25? 25? 25 for, 14 against, no abstentions. Thank you, everybody. Can we now move on to item number 7, which is the motion submitted under Procedure Rule 9 of the Council's Constitution. Councillor Whitehouse.
Yes, Chairman. Thank you for calling the motion to be debated. I won't keep members long. As I'm sure they've spotted by now, I use this to make small announcements on projects that I'm working on because I have no other way of doing it in full council. Obviously, that included the boundary review. I just want to remind members that we're actually reviewing the Constitution at the moment, which is created as a legal requirement by the Local Government Act 2000. I did email all members to invite them to let me know if there were any particular areas of the Constitution that they felt I should be looking at with officers before bringing recommendations forward. I've had precisely no replies to that email. I don't take it personally. Not everybody is interested in the detail of the Constitution, and I will try and do a good and impartial job, and it will come back before full council anyway. No other body within the council can change the Constitution other than full council. The other point that I just wanted to mention is that I've been looking at media spend on the island over the last few years to see whether I think we're getting value for money. We spend an awful lot on the county press, £591,000 over the last 5 years. I'm going to be consulting with other media on the island to see how we can get better value for money from that spend. Particularly in the days of online coverage, we need to review our entire web operation, and that's something that I'm working on with the Assistant Chief Executive to get the comms team to review it, to make it fit for purpose for the future. That will be a complete restructure, so it is a major job. If anybody has any ideas about how we can improve our advertising and marketing spend, that would be, again, appreciated if members could draw them to my attention. On that note, Chair, and by agreement with the Leader of the Council, first I propose deferring the motion to the next Council meeting, at which motions can be taken.
I accept the deferment to the next meeting. Thank you. So if we move on to the second motion, which is Councillor Michael Lilly.
My motion was on the assumption that I presumed that I would actually lose my amendment regarding funding on early prevention. And I just really wanted to put forward a motion to actually ask the Cabinet and the Cabinet members to, particularly consider in the future protecting the funding of early intervention services. It's important, and I re-emphasise what I have before, it's about the LGA. Councillor Antoinette Bramble, chair of the LGA's Children and Young People's Board, said that there should be a wake-up call with the 3.1 billion funding gap by 2025 to maintain the current levels of children's services across the UK. We are facing, in the funding services to protect vulnerable children and young people, which, as these figures show, is now being felt in all towns and cities across the country. The fact that the overwhelming majority of councils are now forced to spend more than they had planned to on children's social care highlights the urgent need for the government to provide new and long-term significant funding for children's services. The Audit Office has said it is clear that the most urgent and pressing issue is not variability, but the real funding crisis facing vital children's services across the country. It is vital the government uses the up-and-coming spending review to deliver a long-term strategy that enables council to meet the growing need for support from some of the most vulnerable children in society. Once a child basically comes into the statutory services and care, to me, it's getting to the stage of being too late. We need to be actually getting at the early intervention, and we need to have the support the teams that actually provide that kind of specialist work. The LGA's Bright Futures document says our children and young people should be getting the best, not just getting by. Helping children and young people to fill their potential is a key ambition of all councils and is a very key ambition of this council. And I welcome and again celebrate the fact that we got an Ofsted good. But our children's services are under increasing pressures. If you look at the data and that, the number of actual children with autism, with other special needs, with issues of mental health, more and more are actually coming into our system. Most of the research coming is that we are having more children that are becoming disturbed than at any time that we've had in the past. And I put this motion to say that I just want us to keep on the ball. You know, people are doing a good job, but we've got to actually focus and we've got to actually make sure that we have state-of-the-art services and investment, and we argue to government that we cannot afford to split and we cannot afford to have future cuts in future years. Enough is enough. We have to give a message to our families of that. There are only 1,200 live births on the island a year. Sorry, 1,200 live births. And the proportion between young people and olds is actually getting bigger. We have got to if we've now got a percentage of young people that actually don't have that early prevention, are the most vulnerable, who are the ones who are poor. We know children have got, in poverty got 11 times more chance to come into adult services. Unless we are really focusing on that, we are going not to have the future generations in a state of mind that can actually support us. I put the motion. I, at this moment in time, would like to withdraw my motion at this particular point because I know that it's actually going to either be voted down or it's going to be moved on. So I wish to withdraw it.
I accept that. Thank you, Councillor Lilly. Right, members' questions, times to the leader. I don't presume too many people thought this would happen. Councillor Whitehouse. Can you switch your mic off, please?
Yes, I would like to ask the Leader of the Council what progress has been made in improving adult social care and children's social services since he became Leader of the Council, and what plans has he for further improvement in these most important areas of engagement?
Thank you, Councillor Whitehouse. Eloquent as always. Since becoming Leader of the Council in 2017, we have made significant progress in improving both our adult social care and children's social services. In respect of children's services, this progress has been validated by our recent inspection by Ofsted. Ofsted has rated our Isle of Wight children's social care as good across all aspects of the service. Ofsted said, and I quote, "Highly skilled, ambitious senior leaders have a clear shared vision and an accurate understanding of the strengths and areas for improvement of the service. Together with political leaders, they have responded well to growing demands, creating a stable and permanent workforce." Ofsted inspectors reported, and again I quote, "Political leaders are engaged with and visible to children and staff. They have a good understanding of the service and have secured significant financial investment. This increased understanding has ensured more vigorous scrutiny and challenge and a greater focus across the Council on meeting the needs of vulnerable children." And I pause at that moment to remind colleagues, this is why I stand fully behind and support Councillor Brading. That's not me reading that out, that's Ofsted telling us what we're achieving. And I think it's very easy to criticise an individual cabinet member, but we should all recognise when he's doing good work. Ofsted helpfully identified several areas for further improvement, as they always do, and indeed they should do. They recommended that children's services and housing work together to ensure there is enough suitable housing to meet the needs of all our care leavers who wish or need to live on the island. And as I pointed out, we're taking a view that our care leavers will be supported by this administration. We are corporate parents. and as they move out into the world, we're going to give them a 100% discount on their council tax so that they have an opportunity to get a start they might not otherwise have received. We're already out to tender for more supported accommodation, creating a pathway to independent adulthood offered locally that is attracting national interest. Our plan for further improvements in children's social care include incorporating children's mental health specialists into our social care service to work directly with children to make an immediate difference. We're also delivering a new marketing campaign to recruit more local foster carers for island children. The outcome of the Ofsted inspection and these examples of further improvements underscore my ambition as leader of the council to provide the very best services we can to vulnerable children and their families on the island. My ambition is no less for how we ensure that the island's elders, disabled adults and their carers live fulfilling independent lives, and I'm pleased to be able to point towards a number of key achievements delivered as a consequence of our Care Close to Home strategy. I would add that these achievements of our adult social care services are increasingly being recognised at a national level. By way of background, over 3.7% of our residents on the island are aged over 85, compared with a national average of 2.4. And these numbers will increase by 20.4% between 2017 and 2020, with 5,300 people employed in social care, the largest single employment sector on the island. Only 65% of our care services across the island are rated as good or outstanding, compared with 80% nationally. Added to that, the adult social care prior to 2017-18 had overspent for many years, and I do acknowledge the very significant funding pressures affecting adult social care up and down the country, including here on the island. Via our Care Closer to Home, we have successfully turned these challenges into opportunities with innovative and radical change, transforming outcomes for those we serve, as well as delivering much improved financial sustainability. Some specific improvements between the 1st of April 2017 and the 31st of December 2018 include a 58% reduction in the rate of permanent admissions into residential care amongst elders, an 80% reduction in the rate of permanent admissions into residential care amongst working age adults, a 55% reduction into delayed transfers of care attributable to social care, and now written up as an exemplar of best practice in partnership working to reduce our detox by the local government association. 203 personal assistants registered with our PA Hub introduced in 2017, enabling people with DPs and PAs to match the needs and preferences commensurate to the increase in the number of people we have choosing to employ personal PAs. Over 66% of all people going through our re-enablement services need no ongoing care and support. I especially want to point towards the success of the Living Well service that we have commissioned as part of that Care Close to Home. As part of our early help offer, we have funded a consortium of voluntary organisations to come together to provide care and support for people not eligible for adult social care. The scheme has been tremendously successful, and I would pay tribute to the leaders in the voluntary and community sector, such as Joe Dare from Age UK Isle of Wight, Lizzie Martin from Carers Isle of Wight, and Terry Baker from People Matter. In its first year, over 1,700 referrals were made to the social care, that's the Living Well service, but only 48 people were subsequently re-referred to adult social care. In addition, nearly half of the people who received support from Living Well stated that without it, they would have gone to their GP or to hospital. So not only is this scheme supporting our adult social care, it is also supporting our local NHS. In terms of further improvement, our adult social care services, we can expect the island's very first extra care facility to open its doors in early 2020. This will provide 75 units of accommodation for elderly people with on-site care and support. Having worked with the Institute of Public Care for the last 12 months, we will be introducing new commissioning arrangements for domiciliary care. We're also working closely with our NHS Trust colleagues to introduce an integrated complex discharge team in order to ensure that all patients leaving hospital, as and when they should, and equally important, go home whenever and whenever possible. We will be expanding our shared lives scheme to see how our shared lives carers might also support people leaving hospital whilst they recuperate, and we are introducing smart kits for people using digital technology to support independence, reducing the risk of falls and reducing social isolation. So as you can see, across children's and adult services, a huge amount has been achieved in transforming the quality and lives of our most vulnerable citizens. But my administration has only just got started.
And on that note, Councillor Stewart, could you switch your microphone off,
sorry.
please? Thank you. Thank you all very much. I really do appreciate your understanding and your niceness to one another, mostly this evening. Thank you very much. I call this meeting to an end.